Hello and welcome on this fresh episode of Hub Podcast. Now we have a guest, I think almost alternate person who would like to meet him because there is something which we are suffering and he might have a solution for that.
In association with Manipal Hospitals, Dona Paula.
We have with us George K.Thangsing, Counselling Psychologist with Manipal Hospital. So these days, more than a physical doctor for other illness, people are also searching doctors for mental illnesses. Now, first of all, what is the difference between counselor? What is the difference between psychologist and psychiatrist?
Right. To put it simply for the masses, psychiatrists are the ones who can prescribe you medication, and that deals with, say, for example, severe mental illnesses. Then comes the clinical psychologist. Clinical psychologists are trained they need to pursue MPhil to be able to diagnose as well as do assessment for severe mental illnesses that looks into accounts of, say, schizophrenia or major depressive disorders, anxiety and all that. Then comes counseling psychologists. They are at a certain extent qualified to at least do certain assessments. At the same time, they are also more engaged with regards to how you can better function in terms of applying different therapeutic approaches. It can be like cognitive behavioral therapy for anxiety, depression or others. So that is how we can always classify. And for that, to be a psychiatrist, you need to pursue MBBS, do an MD, and clinical psychologist, you need masters. After that, you need to do your RCI, that is with MPhil. And then you also have counseling. With counseling, you can go for masters, specialize, as well as PhD, or go for MPhil.
So you are counseling people?
Yes, I'm a counseling psychologist by profession.
You are not prescribing medicines?
No. I am not qualified to prescribe medicine. That is the job of the psychiatrist.
You know to read the brain?
Well, not read, but rather observe the behavior, body language, eye movement, how a person can be tapping his feet, moving around, fidgeting. There is certain cues that we can take time to time when we are in a session with a client.
Okay.
And it speaks a lot of volume as well.
So I have to be little cautious now when I talk to you. You might take some.
But it's always a good trick that you can always use, to observe like what are the different cues that you can see, because it's always very clear in front of sometimes.
Okay. So why I'm asking you this question is that I always have this curiosity that I've seen in some cases the person comes next to you and then he's telling what you are thinking. Initially, for us, it was impossible. How would someone know what is happening in my brain? So they would tell the name, number. Is it possible or it is just a trick?
I think that would be the job of a mentalist. But if you have to come to me, I would have to ask you certain questions, right? My job for you is to help you navigate certain emotion that is hard for you, right? And also make you realize certain patterns of yours. So that we can develop some insights into your problems. That I can actually help you with. Navigate those areas that are causing you significant troubles and problems.
So now, since you are in Goa, what kind of usual complaints that people come up with to meet you?
Number one is addiction in Goa.
That is what? Cigarette?
It can be, right now I think with the party scenes and everything, there are a lot of psychedelic drugs that comes into play.
Okay.
And at the same time, among individuals as early as 17, 18, 19, there are also rampant cases of drug abuse and use as well. Cannabis on the side, and then alcohol. So those are the major cases.
But that's for that you require rehab, right?
Yes. In severe cases where a child, or say for example someone who is underage, is extremely dependent on those, is when you require those interventions. But apart from that, there are cases of because of this drug consumption, anxiety is happening. Anxiety not just because of the drug use, it's because of the financial, professional, their work, family. So that stressors also come into picture. So anxiety, depression, and these cases are really coming up from what I'm seeing right now.
So from Goa, there is a lot of the cases related to anxiety, depression,
Anxiety, depression related.
drug
in those
abuse.
Yes, as well as
Anxiety
drug use.
is a side effect of drug abuse, maybe.
You can say that, but then anxiety can also stem from your personal life, family, and your environment. So anxiety, I think, is a very common disorder. If we look at it, it's known as a common mental disorder. Anxiety, depression, and stress, they come under CMD. That's the common mental disorders. And at least in India, according to the NMHS, that's the National Mental Health Survey, back in 2015 and 16, anxiety, depression, stress were the most cited as for mental health problems.
Okay. So now someone wants to quit drinking. So he should come to you or he should go to rehab?
I think it would depend on the intensity of what his addiction levels are. If he have acknowledged the problem and can at least be know the problem, say a threat at home, because violence happens, stealing happens, or they become a nuisance in the society, right? So before those level of problems happen and they are able to identify, okay, I have a problem, let me go and see a psychologist, then I can help them. But then when there are cases where they have withdrawal symptoms, right, or they get aggressive, then that is when rehab should be considered, I would say.
Okay, so you treat not the addiction, you treat the anxiety part of it.
Well, yes, that is my current focus. But then if they do have addiction issues and they want to get over it, that is also where I come into play.
Okay, so tell us profile of your patients. How the youngest one would be like 15, 16?
16. Yes.
16 with mental health
Yes.
issues.
So the problem particularly is very, again, common mental disorders, a combination of, say, anxiety and depression is what they come up with. And by anxiety, they're not able to function. They have this constant fear that something bad is going to happen to them. Or at the same time, family, the environment which you are in or the environment that you are surrounded by also plays a huge role, right? Anxiety out of family, anxiety out of academic performance, or because of the environment that you are in, or when you see violence around that. So that is the most common that I have been seeing, at least among the younger population.
So their parents are fighting, so they get anxiety.
Yes, it's like a chain reaction of things. And then they also exhibit that into finding, for example, finding peace into drinking, smoking.
Acha.
Right? So it's all connected, that they want to get away from whatever is happening. But then at the same time, they are so young and so close to their family that there is no way they can blame them. So they took it upon themselves all the time. That is when it kind of affects them the most. When they don't blame anything outside or cannot rationalize why this is happening, and they take it on themselves, that is when this consumption or it gets more increased, I would say.
Usage of mobile, do you consider it as an addiction?
Definitely. You
also have this thing for that, solution for that?
I think it depends parent to parent. In Goa, I think parents are becoming very aware of it, like this in different schools at least. From what I've seen, where I'm from, compared to that, I think number one, it's a very good babysitter. Right? But then the problem is that dependency comes, and then at the same time the child cannot function or eat without that particular screen anymore, right? So how do you distract a child into having their meals or doing their work? That becomes a problem now. They will not open their mouth or consume their meals without the screen, right? So it depends on the parent, but at the same time, I'm not saying it should be zero policy on phone usage. I think we can integrate specific timings, more thorough planning, and saying this is the time for screen timing and making sure that they stick the screen time.
When can we say that this guy is addicted to phone?
I think the easiest is if you go and pick it up and they start, throwing tantrums. Not just kids, actually, even us.
Not only kids, I'm asking you generally.
Generally, I think we are all hooked to this. Doom scrolling is the word now, I would say, right? Where you just constantly scroll and you don't know that 30 minutes has passed. But then it's also so addictive because it's short 15 to 20 seconds clip, and it just feeds into your brain, those activities, and you just keep going one after the other. So I think I would say when you identify doom scrolling, that okay, I'm doom scrolling right now, let me at least compartmentalize certain things and put into play here. Let me not touch this or touch that for some time. Internally, it has to come from oneself. But if there's someone underage, I would say it is their responsibility to make sure that they have their screen times accordingly.
So there should be one is self-control, how to use the mobile.
I would say.
And for kids, of course, their parents come to.
Yes, that's
Are you getting those kind of cases also, that my child is, or I am myself phone addicted?
Not
please
in the
treat
hospital,
me.
but in many informal settings during family gatherings, without even the parents telling us, you can see the kids already. But then their rationale for the parents to use the phone is that they don't disturb us. We get to go and do the other works that we want to do, right? So the kids can be there and they're happy with that. But then the consequences, that the problem later on is that they don't have the necessary skills to function.
Okay.
Interpersonal skills, how to have conversation between kids playing around, that becomes different now. They don't talk about the interest that they have, rather it is showing that screen to one another and then being focused on that, right? How to communicate, how to greet, that becomes, they start lacking those. So that is one problem that I start to see, at least among the younger age groups.
So when you go for your community functions and especially friends and parties, you must be the most sought after person. People do come to you and ask, how do I do this, how do I do that?
Generally, yes. The moment they get to know that you're a psychologist, they would come up. They do come up.
You get to give them free sessions.
Well, yes. You just have to be nice about it and say, okay, great, let's talk about it later. But it's not the right time or place. So, but generally, people do come and actively ask you questions that they want some answers to. You know. But then therapy is not like that. It's not quick. It's rather, in the first session, say example, I would take my time knowing you better so that we can navigate what might be the problems. We cannot just focus on the problems right away. We can, but then we need to build it around, right? So in those events, it is just, okay, what is the problem? They tell you the problem, you listen, and I try not to offer any advice because that's not ideal, right? Instead, we just say, okay, my my trick is, how is your gut health? Because number one, when you have anxiety, depression, or any sort of mental health problems, your gut, your tummy, is the first indicator of a problem that is coming up, right?
Okay.
So when your gut, so I tell them, how is your appetite? How is your gut health? Are you drinking enough water? How is your sleep? How is your energy levels? At that level is when I ask them, like, is it good? So I tell them, please drink enough hot water so that your gut health is always good. You don't have any acne breakouts, or you don't have any problem per se when it comes to that. So take care of your gut health, then we can see it from there, is my approach.
So that is for the first sitting. First sitting, I think first you have to win the confidence of the
Rapport building.
patient.
Yes, we need to build rapport. Because if I don't build good rapport with you, there is no way you would open up to me. I'm a stranger first, right? And I should be ready enough to make sure that you are comfortable. Tell you the confidentiality clauses, and make sure that you are comfortable and is willing, without me extract or pushing you. You yourself tell me what the problem is, depending on person to person. But I also feel, since we're in India, money also plays a big role. So there is no way someone with very limited financial capacity can be like, okay, let's talk about this in the third setting. Right? So sometimes clients come in and they do want to share it in the beginning in itself, like the first session, which is also good. We call it free association, where we let them talk. Whatever is in their head, whatever is in their mind, they share. And that is a bit cathartic for them, because some weight is coming out of their chest that they are able to tell someone.
Vent it out.
Yes, venting it out. But then there are some cases where they just don't want to talk.
But it will take time.
It will take time.
But
So
is it also
depends.
helping you that you are not from this state? that you are not my cousin, you are not my friend's friend,
Hmm.
so that I can share all my secrets with you, all my worries with you, without getting afraid that some other day you might share it with my friends.
Exactly. This is where the importance of confidentiality comes into play, right? I tell them that whatever we discuss here will remain confidential, and you will not be given out on anything, except in cases where you are at risk of suicide or harming yourself.
Huh.
That is when I would have to report it to medical and
Family.
family or authorities. Only on those cases am I allowed to break that cases, which happens very rarely,
Hmm.
right? But that is the confidence we give them that whatever we discuss will remain here.
Hmm.
And
So you are a secret keeper for many people.
yes, I think I
You seen a lot of secrets.
I believe so.
Okay, so it helps because you are not means in a way it helps because you are not related to anyone. That also contributes for confidentiality.
Yes, definitely. Again, when it comes to help seeking, for example, there are two things. There is formal and informal.
Hmm.
Formal is psychologists, psychiatrists, and mental health professionals.
Hmm.
Informal are the pastors or the religious leaders,
Hmm.
friends, mother, sister.
Yeah.
That comes into play. So
There are confession boxes
yes,
also in
so
the church.
but then when it comes to things such as deep as mental health struggles that you have,
Hmm.
confidence cannot always be there because you are giving it to someone who is not equipped to handle those kind of information.
Hmm.
And when you have to listen to someone with problems, sometimes you might not be able to handle it, so you need to share it with someone.
Hmm.
So that is where the parents, sister, or friends are not the right key to
Correct.
go and share that, because think about it, they cannot hold it because you are so close to them, and then they do feel the pain that you have, but then since they can't hold it, they also have to share it. So that's also where the confidentiality clause becomes a big issue. But when it comes to professionals like us, there's no way we can share it with anyone until and unless it's called for.
Culture of any state is an important part of mental health.
Yes.
So now, how do you means you are in Goa right now?
Mm.
The entire culture is new for you. Have you done any study about the culture? When someone says that I have done this as part of this, so it is stressing me.
Mm.
So culturally, you have to be knowing a lot of things. Like if I come to your state, I'll take little time to understand the culture there.
Right. Thank you for that question. So my thesis also focused, my PhD thesis focused on causal belief, etiologies of mental illness,
Huh.
right? So one thing as people in the practice, what we should remember is that what you think causes mental illness might not be the same with me. Okay. What you believe cause mental illness for you might not be the same for me. So I need to understand and respect that. For example, I can say, Mr. A thinks that his anxiety and depression is because someone is doing black magic on him,
Hmm.
right? And the problems get severe, right? So there is the culture that we also need to understand where he is from,
Hmm.
right? What is his background? And these issues are not just cultural, so it's much bigger than that sometimes. It's their environment, right? So when someone believes that my mental health is because of someone's black magic, my karma, they wouldn't go and approach a psychologist. That is the problem. Instead, they would go to a pastor or a priest, and they would go and talk about it so that they can at least help them, right? Or in some severe cases, when, for example, epilepsy, right? When the body is into going through that shock, people believe that they are being possessed, right? So in the case of, say, for example, in Manipur, previously, now that we are, some mental health literacy is there, previously we would say, oh, this person is possessed, because we didn't have the knowledge about it. So the interventions we took, rather than helping them, made them more ill. And in some
Okay.
cases, they sadly pass away as well. So, like you mentioned, we need to understand the culture and the background where this person comes from without judgment. We have to accept it that, okay, this person truly believes that this problem is from there. So let's work around that and try to help him navigate that area. I can't challenge them right away, but my job is to make sure that they understand where this problem stems from and how we can work on that.
Who takes care of your mental health?
Oh, so as psychologists, we also have to go to for therapy,
Yeah.
right? So I also have a therapist, and I also go share my problems sometimes, because I'm human, right? I also go through affliction, sometimes work stress or any other problems that come, or in some cases when, for example, I work with during COVID, as well as after the Manipur crisis, I work with internally displaced people in relief camps. So when I did my work with them, I did some research among them, and after hearing their stories, I also get affected. So that is when I also had to like go and approach my therapist and at least share like this is what I'm going through right now, and that talking about it, at least that also helps for me.
So even now in day-to-day life, you have to listen to so many stories, so many things. It also gets piled up in you because your thought process, you must be, analyzing those thought processes. Or maybe I'll share my difficulty with you, and I am free. I have vented it out, but I have given it to you.
Yes.
So how do you manage with that?
So number one, I have to compartmentalize it. I personally have to talk to myself and say, okay, what we talk about here is not what I'm going to take home. That doesn't mean I don't care for my client. I do care. But if I can't take care of myself, I can't take care of my client. So I can't take my client's problem home. There is a time and place for me to formulate what treatment plan will work for them. But I cannot take that problem home and think about it and be more stressed about it. So that is where we have to compartmentalize and make sure that we do not take our work home sometimes. And then we know the right time and place to do those things and work on that.
How do you remain not judgmental? Because this is for all those people who are very judgmental about other people. Give us, this is free counseling, but tell us free advice on how to not to become a judgmental about someone.
Well, during our training, or at least during our masters, it's one prerequisite is not to judge in any way. Whatever problems, whatever thing that they do, you just have to listen. And judgment should never come as a core thingy. It's a given that judgment should never prevail while you are listening to someone who is coming to you, trusting that you will listen and help them. So, to be honest, I don't think judgment have ever crossed my mind where a client had come and they shared. None.
Tell for a common person, because we are not trained people. So how do we handle and how do we become non-judgmental in our approach?
Well, I think we have to empathize. We need to understand that, okay, this person is going through this problem. They also have their own issues. And I should just listen to them rather than judge, because I don't know your story. I don't know their story, right? What kind of background they had, what they had to do to get here. So it is about just understanding and lending a listening ear. Like, this ear is for you to listen. And I'm not going to judge based on that because I don't know your story, right? So that's it. Empathize, as well as, I think we can always sympathize with everyone, but sympathy is not what everyone needs. A listening ear who can empathize and say, I understand. Okay, cool. Great. Let's work on this. That's all.
So you have to be in the patient's shoes every time to understand what they are facing?
Yes. In some cases, say for example, when it comes to caretakers, for example, someone like a daughter taking care of her father's cancer treatment, right? I don't have anyone who is going through cancer, but then her emotion is also through loss, grief, as well as that anxiety of, okay, something might bad be happening, right? So it is when it is understanding that, okay, this caretaker clearly is a little exhausted. She also needs to, she's anxious about the future. There is a lot of issues, right? So it is just about making sure that she feels heard. Like making a safe environment for her where she can just feel that I can come and talk to you, and all I want to do is just help you listen. I cannot understand what you might be going through internally with regards to loss or the anticipated anxiety of losing someone, right? So in those cases, it is just saying that I understand what you're going through, and I just want to help you, and I'm just here to listen in those cases.
How do you, how someone will realize that, okay, I'm facing mental health issues right now? Because many a times all the behaviors are, new normal. Sometimes shouting becomes new normal. Firing bad words becomes new normal with OTT coming in. How do I know that, okay, now I need to meet you in Manipal?
Right. So there's a concept called mental health literacy, right? It comes from health literacy. By health literacy, I mean, if you have a headache, you know exactly what to do. If you have a broken bone, you know exactly what to do. But mental health literacy is when you need to recognize, identify, know who to approach, when to approach, what is the problem, what is triggering it. That is mental health literacy, the recognition management, right? So that is what we need to do. And sadly, we are not very mental health literate because for a typical Indian family, mental health is not always the right priority, the first priority, right? So we don't recognize those patterns sometimes. And by those patterns, I mean, for example, like you mentioned, constant shouting or a change in or being aggressive a little bit, suddenly becoming short-tempered or having douse of emotions and you don't know where it's coming from, right? So that is where we need to be a bit more mental health literate so that we can identify our problems, what is triggering us, what is our triggers, what can be the problem right now, and then having the confidence to apply for and ask for help with the right professionals. That is what I would say.
No, right now the biggest challenge is to normalize the fact that I am meeting a psychologist or counselor. Because right now if I tell someone ki I am meeting you, people will say ki he's mad.
Something, yes.
Okay. How do the society or people normalize the thing? Like when I have a fever, naturally I will go to a doctor. So if I am feeling stressed or depressed, not that I am mad, but I need to get rid of it. That's why I am going to meet you. How do you think that society can normalize this thing?
I think we are, when it comes to this, I think that Generation Z, millennials are very open about therapy now. Okay. They are, one thing this is the new trend that I have seen, is that even from my research also that the older generation are catching up with what mental health is about, what therapy is about. But the younger generation, the kids right now, they are open about it and they are unabashedly very openly admitting that they are in therapy and they are choosing help. So that is one shift that we are seeing right now. Yeah, and I think I would say right now, but the problem is in India at least, the parents control the finances, right? So the parents need to believe that mental health is important, because if the child, who is a young generation, they already believe that mental health is important, then the one who makes a financial decision, the parent, the older generation, needs to be a bit more aware, is what should be the tag, I would say.
Okay, like we have regular blood sugar or blood tested, though we never sometimes we might not have a problem, just to make sure that all the parameters are normal. Do you also suggest that people should once in a while go and talk to counselors and try to know ki is there any issue that is coming up, or maybe eventually I might get into a bigger issues?
Yes. Again, therapy or seeing a therapist or any mental health professionals should not be approached when the problem becomes too severe. And there is no such rule that you should only go and approach them when you have a problem. You can go and talk to them when you're the happiest. You can talk to them when you don't feel.
But you wouldn't throw them out of your cabin, no, saying that why you have come, you have no problem, man.
But then, no, actually, we welcome that a lot. When someone says, no, I just want to come and talk. Like, they don't have any deep underlying issue like someone going through loss or grief. They just want to come and talk, and then that's there. We actually very much appreciate that.
That's okay.
That's very much okay. It should be normalized as much as we can.
How do someone de-stress himself on his own immediately if something is panicky around him? There is no help coming in. So for him, how do someone de-stress? I'm asking you scientifically.
Yes. There are relaxation techniques, like we have the JPMR, Jacobson's progressive muscle relaxation techniques, where one has to lie down, but it's also through breathing exercises and making sure that there are tensions on your body. By that I mean you hold your fist up like this and then you release slowly while breathing at the same time. So we focus from head, shoulders, arms, then down to the bottom. So we do that. So there are relaxation techniques that can help. But the simplest home solution would be to lie down on the mat focus on your breathing. Like you mentioned, sometimes you can feel very panicky before an interview or something, or before a presentation, before any appearance, for example. That is when you at least take 5 minutes, is not much, focusing on your breathing techniques, making sure that your mind is blank, because you already feel anxious or some sort of fear is there, right? So it is also making sure that, okay, talking to myself, I can do this, let me breathe, focusing on your breathing, and then from there just taking it forward, I would say.
So the best suggestion is that let the bad thoughts come in and go, or we should keep them away.
You can't keep it away.
Let them come.
Let sit with them, be uncomfortable. Because, for example, when we say meditation looks very easy, but 5 minutes feels like 20 minutes sometimes, because you are just stationary, and you should let everything come, whatever it is, deal with it. But then, are you able to cross that 5 minute mark without opening your eyes, without losing your concentration? That's a little question that we have to ask sometimes. Like, how much am I able to focus, as well as not be distracted by? But then also making sure that whatever comes in my head, let it go. Like, let it be there, and then I'll deal with it.
Our focus time has decreased with
Very
mobiles
much.
coming.
Yes. Attention.
People don't watch. I don't think even this podcast, people will watch when they are into reels. People would like to see that when you are sitting here for half an hour, they would like to watch more, but they were like, okay, I have to do something.
Now just a
else.
quick bite is good.
Yeah.
You know?
So how do is that also a mental illness?
There is ADHD, attention deficit, but then there's also latent diagnosis happening now, where people are, again, ADHD is not just about the attention aspect of it. It is also very emotional and mental as well. Sometimes you can have certain problems wherein mentally you don't feel great, but at the same time your concentration is down. You can't focus on certain issues. Say, for example, I have been in academics for a long time now. In academics, one problem that we always see is that, or at least complain among my friends and colleagues, is that I can't concentrate. Should I go for an ADHD diagnosis? And they do come back, and then they are also diagnosed with severe to mild form of ADHD and some sort of disabilities around there. But the concentration aspect, where they just cannot concentrate, like 5 minutes feels too long. So then the phone is right there, they'll go and distract themselves there more. So, but to answer to your questions, is it a problem? Yes, it's a big problem right now. And with mobile phones coming around, everything is just so much easier that we just want an easy access to it. In terms of lecture notes, in terms of, say, for example, AI for that matter, the dependency is crazy right now, right?
True.
So for
So
someone,
people will ask ChatGPT more questions about their own life than a doctor or a parent.
So one thing that we're seeing right now is that people are using ChatGPT as their personal therapist, right? But the problem is that ChatGPT will tell you exactly what you want to hear. If you say, oh, I feel like, doing something to someone, ChatGPT will validate you and say you have all the rights and your emotions are in the right place to do that. So those things are coming up where it's, replacing therapy. And people are slowly picking up on that. I think there is ethical AI use, but when it comes to things like this, I think it's just it's like feeding you the same thing to whatever you do wrong. I'm just going to say, you are right. It's okay. So don't feel bad.
So what is going to be in future? You tell us, predict the future in this kind of thing, wherein AI is, ruling our mind or thought process. People are getting hyper. People are not concentrating. I think what is going to be the future?
This is the problem that we are dealing with even in academics, is also that how do I know the assignment that comes is not AI generated but human? And to deal with that, we have AI to understand this is AI. But to also deal with that, we also have humanizers now, where if ChatGPT writes you something, I can use this software to humanize it so that there's no AI percentage or detection happening.
Okay.
Right? So that is one problem now. But then when it comes to the addiction and use, I think it needs to be more systematic. It needs to come from the top. Say, for example, we need policy in place where how much of ethical AI use are we going to allow or at least incorporate into our daily life and everything. I think those boundaries needs to be set, and I think slowly other European countries may be using it now, but in India at least I don't see that happening anytime soon. It's a huge market that we need to cash in, but also as problematic as it is, I think there needs to be a system where we can organize it more, I would say from the top in terms of policy making.
So, but in future, I think you will require more psychologists, unfortunately.
Yes, and we are, at least in the Indian context, we don't have enough mental health professionals. There's a lack of resource, there's a lack of professionals as well. So that
gap needs to be filled.
That gap needs to be filled. Like, for example, at least here in Goa, I think Goa is doing amazing. 100 rupees OPD at GMC, that's not bad.
Yeah.
But then if we look at smaller states, say for example the Northeast, and also India doesn't have a mental health policy yet, right, or a state policy. I think Meghalaya is the only one that have. Say for example, where I come from, Manipur, if I have to see a psychiatrist in my district hospital, post-violence, I think there is one psychiatrist. So one psychiatrist serving like a lakh of population, that's a very limited one, right? So that's
per population ratio is very less.
Very less, like below, it's just
below much below the average. So now if people want to contact you, then they should go to on Manipal's appointment helpline.
Yes.
And then
they can approach me to Manipal, or I also do my private practice.
Okay.
Where I take in clients and online sessions, and yeah, that's it.
So they can come to Manipal and meet you also.
Yes.
So that you have time. How much time do you take per patient?
Generally, therapy is centered around 45 to 50 minutes.
Okay.
I wrap it up in at least 45 to 15 minutes.
So you are limited people to
yes,
whom you can entertain every day.
Yes, sometimes therapy can go on for long, sometimes it can go on for short, but on the average, we keep it at 45 to 50
minutes. Thank you very
Thank
much
you so
for
much.
joining
Thank
us
you
on the
for having me.
podcast.
Thank you.
You're watching Hub podcast on your favorite channel, Goa News Hub. But before we wind up, make sure that if you have any mental health related issues, consult a proper expert and try to, I wouldn't say treat it, but at least address it. Treatment is another part, but at least address it, because sometimes mental health results into other physical issues also, and then you are ruined. You're watching Goa News Hub. Keep watching.